Since from that time, I am in dialysis.
On the outskirts of Bangalore, India's third largest city, a unique experiment in healthcare. A hospital with a difference, determined to make a difference. This week on Indian Hospital, a nervous Prabhu faces his cornea transplant.
Okay, just relax, just relax.
The trainee nurse intensivists struggle with their increased workload.
Yeah.
A decision is made on young Beamish's back.
Yeah, it's sometimes a difficult choice.
And 20-year-old Navya searches for a kidney donor.
Even my mom didn't say that you have kidney failure. She didn't say.
"30-year-old Prabhu has been suffering from terminal motor neurone disease for half his life. A recent side effect has been the deterioration of his eyesight to such an extent he's had to quit his job. But today's a big day. After an 8-month wait, he's been driven across the city to have the first of 2 cornea transplants.
They'll be doing it in the local anesthesia. So I thought, I'm a bit nervous inside, but then let's see how it is.
Although excited that a suitable cornea is finally available, Prabhu is extremely nervous. The hospital is sponsoring the operation, but to keep costs down, the procedure is taking place under a local anesthetic injected directly into his eye.
Prabhu, hello. You're fine? Okay.
Yeah.
All set, huh? Good, good. Chal, fine. No problem. What we'll do is first we'll start with the donor tissue. We'll cut the donor tissue and those things. Then
The arrival of the eye surgeon, Dr. Himanshu Matalia, sends Prabhu's pulse almost off the scale. He'll have to be calmed down before he can be operated on.
Okay, just relax, just relax. No need to get tense and no need to get worked up, okay? Okay, just enjoy yourself. Right? You're going to be very fine, don't worry. Okay, you're my responsibility.
Sure, sure.
Using a laser, Dr. Himanshu must prepare and cut the corneal tissue from the donor eye. The same cut will be done on Prabhu's eye, so the shape of both corneas are identical. It's exacting precision work with no room for error. Meanwhile, Prabhu lies in the pre-op room. His pulse has returned to near normal and the operation can go ahead. Two months ago, 12-year-old Beamish, affected by a severe spinal deformity, attended an orthopedic clinic here at the Sparsh Hospital unit in Narayana Health City. 500 children came, hoping they'd be chosen for just one of the roughly 120 places available for free surgery. Today, Beamish and his father have arrived at the hospital for the final decision. Will he or won't he get the surgery that'll save his life? If he's refused, he'll probably die before reaching adulthood.
Big one. It's definitely a big one. Bagi kal touch ma. Straight type. Right up. Going right up. Going right up till. Yeah. Hinti kade. I'll go all the way up, I think. Because his shoulder. Malkonde. Pada mele mado. Okay. No unta. Illalla.
The panel have decided. Beamish is going to get his operation and the family will pay nothing.
ಅದೆಲ್ಲ ಟೆಸ್ಟ್ ಆಗಿ ಆಪರೇಷನ್ ಮಾಡಬಹುದು ಅಂತ ಹೇಳಿದಾಗ ಆಪರೇಷನ್ ಅಕ್ಟೋಬರ್ ತಿಂಗಳಲ್ಲಿ ಮಾಡೋದು, ಮುಂದಿನ ತಿಂಗಳಲ್ಲಿ 3ನೇ ವಾರ 20ನೇ ತಾರೀಕು ಕಳೆದುಬಿಟ್ಟು ಮಾಡೋದು.
They are saying any date is okay for them. They are quite close.
The following morning, Beamish has his final briefing. It's going to be a complicated operation which will take at least 5 hours. Normally, such a procedure, even at this hospital, would cost several $1,000s.
Normally, the spinal cord sort of ends at L1 and the L2 vertebrae. In this kid, what's happened, the spinal cord is going further down, right up to the sacrum. And it has sort of split into 2 pieces. And in one of those pieces, he's also got a huge lobule of fat. So essentially, we need to do 2 things. One is release the spinal cord from its lower end attachment and take out this fatty tissue which is in the spinal cord. So because we are dealing with the spinal cord and the nerves, there is a risk involved in that he might have a worsening of his neurological function. That's why it's better to take the risk involved and operate him now rather than wait till he develops those problems. And once this is released, they can proceed with straightening his spine. If they try to straighten his spine with it attached here, it's going to get pulled, and that pulling itself can worsen his condition. So for now, first step is to release his spine and take out that congenital abnormality.
Very simple. Show them so many things, key, pen, whatever it is.
The nurse intensivist course has been underway for 6 weeks, and the 44 nurses are still finding their way. But their teacher, Dr. Rajagopalan, isn't happy.
I take the ramp all the time, Patricia. I take the ramp all the time. The young nurses cannot take the ramp. I'm not very happy because I always come here on time and nobody's here on time, Patricia. This is not right. Yeah, because I've been very nice, Patricia. I mean, there is a patience limit, isn't there? So I'm very upset with these guys. I don't know what they want to do. Okay, I'll do the best I can. Okay. So they're supposed to be here at 12. Indian punctuality is the best in the world. You can shoot me for that. I'm an Indian too. We have the best punctuality in the whole world. When we say 12 o'clock, that means 12 o'clock midnight. See, I'm here every time. I come here on time. Nobody comes here on time. And I take the ramp. I'm an old man. I take the ramp. They all wait for the elevator. Young people like him and him, they all wait for the elevator. Right?
Who's this?
4 months into the nurse intensivist course, the nurses are getting plenty of hands-on experience. But their tutor, Dr. Rajagopalan, is strict and it's not going well.
Nadeepa? Okay, ready. Divya? Who is presenting, Divya? Okay. Tell me where it is, popliteal. Huh? Where? Show me, just don't point your finger like that. Huh? Behind the knee. So you have to say it is behind the knee. Okay. And what about in the feet? What are the vessels? What is this artery called? Huh? Huh? Dorsalis pedis. Okay. What else? What other vessels are there? Posterior tibial artery. So you're not familiar with all those, no? You have to say, so did you feel all those vessels? But you didn't know the names. This is normal. This is dullness. Okay? So you didn't do it before. I don't want any lies. I told you, right? I didn't do it. I asked the nurse, how long will it take you, Divya? Why are you telling me lies after lies? You didn't check it, but then you're saying thermometer. Then you're saying, be honest. Say, I didn't do it. I asked the nurse, or I did not do it. Whatever it is. Then otherwise, when will you learn? All of us need it. Doctors, nurses, honesty. Be honest. Okay, sometimes we hurt people, patients, by errors. We have to admit it. We have to be frank. We have to be honest. So we don't repeat it. So that makes you better next time. Okay? So anything you do, anything you don't do, you have to just tell me. So you did not do it. So can you speak up, Divya, please? Can you speak up? Huh? Huh?
I asked the sister.
You asked the sister? You did? Oh, you did not. You did not. See, again, another one. Okay, this is the last time, Divya, okay? Next time, only things you do, only things you ask, you tell me. I think I made my point today that they cannot lie. To cover that lie, they tell second lie, third lie, and it keeps multiplying. So we will make her do it tomorrow, and I'll be very observant. I just know who is being honest, who is not being honest. Sometimes they're not being dishonest because they want to be dishonest, because it cuts out embarrassment. They don't want to look small.
With the donor tissue prepared, it's time for the matching cut to be made into Prabhu's eye. The operation will be performed under local anesthetic, injected into his eye. Prabhu will be awake and fully aware of what's going on. It will be a big test for Dr. Himanshu to keep him calm.
I talk to them about different things. I mean, it may not be anything related to the eyes. It may be about their personal life, and as in like what do they do and what are their hobbies. Or I talk to them about some motivational stories or some story which my mom had told me. So yeah, I do share all those things with them, and it usually does calm them down. Do you want me to talk to you, or do you want me to keep quiet?
I think it's okay.
Whatever you feel comfortable, I'll be fine with that.
Yeah, okay.
Okay. This was a story which my mom told me when I was a kid. So the story is like two angels were traveling. They went to one rich person's house. Said, "Sir, can we stay here overnight?" That fellow was like, what? Such kind of people come.
As he stitches the new cornea into place, Dr. Himanshu's various fables seem to work.
You can